Friends, and welcome to FYI for your information, streaming exclusively right here on KMOV's Facebook page. But since you're watching, I guess you probably already knew that, didn't you? Thanks so much for joining us this afternoon. I'm Matt Chambers. Here's a stat that's tough to wrap your brain around. Half of adults age 50 and older are at risk of breaking a bone due to osteoporosis. In fact, above and beyond that, 1 out of every 2 women will break a bone in their lifetime as a result of this condition. How about that? Now, some risk factors for osteoporosis are out of our control, things like age, sex, race, but there are things you can do to help prevent or treat this condition. Matt Bruns was nice enough to join us on the tail end of our noon newscast, and here he is again. He's an orthopedic nurse practitioner with SSM Health Orthopedics. Thank you so much for being here today. We appreciate it. How long have you been doing this kind of work? It's been a while, hasn't it?
Yeah, 16 years.
16 years. Well, you get him for about 15 minutes. That's the best we can do because he's a busy guy. But here's the thing. He's here for you, so post your questions below. I've got my phone. I'll be watching the feed in real time, and I'll try to get as many of your questions over to Matt as I possibly can. You game for that?
Yeah.
Okay, great. So let's start with the nuts and bolts. I don't want to assume that anybody knows anything about this. What is osteoporosis? And a lot of people hear the term osteoarthritis. So help us understand both and differentiate between the two.
Yeah, so there's actually a very significant difference between the two. Osteoarthritis is typically where the cartilage between the bones at the joints wear away and subsequently lends itself to inflammation and pain, whereas osteoporosis is actually a silent disease. Most people are completely unaware that it's present until they unfortunately fall from standing height or have a low traumatic injury and suffer a fracture. And that's oftentimes the first warning sign that patients may be at risk. The other way in which you can know that you have osteoporosis before a fracture occurs is by getting a bone density checked or a bone DEXA scan. And that is a great way to tell whether or not the bones are becoming weak and brittle, and subsequently should you be doing something about that.
Talk to me about that. I'm 45 years old, generally in good health. Too young to start thinking about bone density scans? When do you start doing it? And then once you're into that, how frequently do you have to go back? How quickly can it change?
Yeah, that's a great question. I think that number is actually getting younger and younger. We know that there are some people who are predisposed to weak bones for a multitude of different reasons, whether it be some type of genetic issue, some type of medical treatment for some other condition that predisposes those folks. But typically we think about people over the age of 50 as the first kind of hallmark. Age 65 for women and age 70 for men is typically when Medicare will pay for or approve a bone density check or a bone DEXA scan. But there are people who over the age of 50 and even younger who have those other risk factors that I talked about. So smoking, alcohol use, chronic steroid use, history of rheumatoid arthritis, history of fracture, parental history of a hip fracture. Those are all big key risk factors that as you age, you probably would benefit from a bone density much earlier.
What do we know about a genetic connection? If mom, if grandma suffered from osteoporosis or more acutely osteoarthritis, does it seem like our risk is going to be elevated?
Yeah, unfortunately, there's a big genetic risk associated with osteoporosis. And one of the questions that I ask every patient that I see is, did either of your parents ever have a hip fracture? What I'm really trying to ask is, did either of your parents have osteoporosis? But we know that if they did have a history of hip fracture, that's a clinical diagnosis of osteoporosis. So that lends itself to your risk. And unfortunately, I tell patients, this is a gift that keeps on giving from generation of woman to generation of woman. And women tend to be more at risk for osteoporosis once they become postmenopausal.
Gift that keeps on giving in the worst possible way.
Absolutely.
Great questions already coming in. If you're just joining us, by the way, on KMOV's Facebook page, Matt Bruns is an orthopedic nurse practitioner with SSM Health. He's nodding, so I think I got that right. Fantastic question, because we're talking about bone density scans, DEXA scans, and so forth. Kevin asks, Kevin and Wendy, it's kind of a joint account. They ask, can women with knee implants get bone density scans? Are there people that, for whatever reason, I'll broaden the question out, are not able to get a scan like that?
Yeah, you could get a bone density scan with having joint replacements. There are 2 key regions of interest that are typically monitored for bone density. That's at the hip and at the lumbar spine. So frequently people will have a hip replacement, and that's not a good measurable area.
Okay.
So we will oftentimes substitute the forearm as the next location that most people have access to and readily can measure the bone density. But the hip and the spine is where most of the science is published about the benefit of monitoring and making treatment decisions based on those numbers.
Interesting that those are the two of the most commonly impacted areas in terms of discomfort and pain and so forth. Phyllis has a great question too, and I'm sure you deal with this a lot because medications are what they are, but it may not agree with everyone. She says, I was recently diagnosed with osteoporosis. The medication made me sick and I had a bad reaction. So she asks, now what? I'm sure there's other medications, but could there be other prescription alternatives?
Yeah, so there are, I mean, outside of calcium and vitamin D supplementation, there are a few other nutrients that some people may benefit from supplementing, but those are the key ones. Yes, not every medication is tolerated well. There are some nuances to that. Sometimes it's a matter of how you're taking it or when you're taking it throughout the day. Yeah, it's important to understand those things and why someone may or may not have had a reaction or an adverse effect. But there are also multiple other options available that can be utilized.
I think there's a general thought out there among many that this is a natural part of the aging process. Is that accurate? I mean, is it one of these things where if you're fortunate enough to live into your 90s, you're probably going to have it? Or maybe the broader question to ask is, how common is osteoporosis really?
It's very common. It currently affects just shy of 50 million Americans in some capacity. As you mentioned, 1 out of 2 women and 1 out of 4 men over the age of 50 will suffer an osteoporotic fracture.
1 out of 4 men too?
Yeah, in their remaining lifetime. And that's the unfortunately the untapped kind of population, is because men are also affected, and there's a multitude of reasons for that. Men who receive treatments for prostate cancer can often be at increased risk. But you know, I always tell patients that we're tailoring your treatment based on your risk factors and your you know, current age and basically risk stratifying how should we be treating you, because this is a chronic disease. This is like people with diabetes. Once their blood sugars are normal, we don't just stop treating them. So when I talk to patients, this is something we have to think about for the next 90 years. But for every decade of life over the age of 50, your risk of fracture does increase, but most fractures are preventable.
It's good to know.
That's the key.
And that, yeah, well, and maybe now is the appropriate time to ask you the question. As a nurse practitioner who specializes in this field, what do you do to help people? What's a typical day like for you when it comes to treating osteoporosis? Yeah,
so basically it's a multitude of things. It's understanding how their diet is and are you getting enough calcium in your diet? Understanding, are you falling? If you're currently having falls, your risk for more falls is significantly increased. Considering formal physical therapy. We have a very good dedicated bone health physical therapy program through our region for these patients specifically. We've seen dramatic improvement to the point where patients after 8 weeks of therapy were able to lay in bed for the first time in 3 years because the osteoporosis and the bend in their back was so severe that they were unable to do that. So by focusing on balance training, postural exercises, core strengthening, fall prevention, we've had dramatic impact in these patients' lives. But it's a matter of assessing all of those different things and then making a treatment decision that, like I said, may impact the next 20, 30, or even 40 years in some patients.
I would have to think that, again, a lot of this is about learning about the patient's history, their dietary lifestyle, the sedentariness or activeness of their lifestyle. Do you have, I assume you have to have a decent amount of time with individual patients to be able to make that kind of diagnosis and figure out where to go from there.
Yeah, all of my bone health patients are scheduled for 40 minutes for this exact reason, because it's a detailed, comprehensive look into your life and how did you get here and what are we going to do moving forward. And understanding that, yes, postmenopausal women over the age of 50 are at the most risk, but if there are other outside factors, such as a female who had a history of breast cancer, some of the medications that they go on subsequently may impact their overall bone health. and making good treatment decisions, taking those things into account is important.
We talk a lot about diet. You've brought it up a couple times, so let me focus on that for a second. And Ronald gives me the perfect excuse to do that. Ronald asked the question, I've been told all my life that drinking milk will help strengthen my bones. Is that true or not?
Yeah, that's a great question. It does, in fact, increase or have an impact on bone strength. Mm-hmm. We know that calcium is best when it's taken in by your diet, but frequently people do not consume a lot of dairy products, and therefore getting your calcium adequately in your diet is a challenge. And so supplementing to get to 1,200 milligrams daily is the goal that we want all patients. And I always tell people that's in combination of diet and supplement. It's important to take the supplement at the correct times and avoid taking it all at once. But green leafy vegetables, milk, dairy, those are the key. Some nuts, some salmon are good calcium-rich foods that people can consume.
And we talked about exercise and load bearing. We discussed this on the noon newscast a little bit, how counterintuitive that might be for some people. If we're talking about if we're trying to talk about combating a disease that is known for making your bones weak and brittle, it feels like the last thing you would want to do is go slap a few 45s on the leg sled, and start working out your lower extremities. But if you can get into that sort of lifestyle early enough, it pays huge dividends down the road, doesn't it?
Yeah, it absolutely does. There's actually a unique phenomenon in orthopedics or in musculoskeletal health called Wolff's Law, where if you actually load the skeleton, it stimulates the bone cells to form bone. And so by adding that load with weight-bearing exercise, it tells your bone cells, we need to form stronger bone around this structure to support that load. And it's actually a really cool phenomenon. But like with most exercise, it's best done in a fairly supervised or controlled manner. It's not a matter of herky-jerky movements in the gym and slapping those plates on like you suggested. But we know that some folks do that. And so that's why it's super important in the physical therapy program we've developed to help guide patients. What are those best exercises to do?
Interesting. On that note, I guess I'm trying to grapple with the idea of sort of what intensity level of exercise is enough. Here's a good example. LaTanya says she's been diagnosed with osteoarthritis, but doesn't have any pain. She's not on any medications. She's 55. Her mom suffered from it, and she's wondering about types of jobs she should have. In other words, she says, should I be looking for jobs where I'm, for example, standing for long periods of time? Is that detrimental? Is that helpful to someone with osteoporosis or osteoarthritis?
With osteoarthritis, I encourage all patients to be as active as you can be.
Keep moving.
As you become sedentary, let joints get stiff, it's seldom a recipe for success. So keeping active is almost always the best. But we do know that exercises and certain occupational hazards or activities can create more stresses or create more inflammation in a joint. For instance, someone with knee osteoarthritis who's up and walking for several hours at a time throughout the day, that may make that knee a little bit upset over the course of the day, and at night you're probably going to pay some of that back, so to speak. But it's still important to stay active. That's the most important thing.
And the earlier you can start that kind of lifestyle change, the better, obviously.
Very much so.
Matt Bruns, nurse practitioner in orthopedics with SSM Health. I'm going to give kind of a pseudo last call for questions because he's got a busy schedule. We can't keep him here all day as much as I would like to. But I get first dibs because I'm the host. This may be a stupid question, but I'm pretty sure I heard you say that very often, or it's not that uncommon for a bone break or a fracture to be someone's first indication that they've been dealing with osteoporosis for quite some time and didn't know it. So let me ask the question, how does a person know? Short of getting into DEXA scans and bone density scans, are there any signs before you suffer a more acute injury that you might be dealing with osteoporosis?
Yeah, unfortunately, there are seldom a lot of warning signs or flares, but in orthopedics, that first fracture is such a warning sign or a flare to us. So I always tell patients that, someone 50 and older who falls from standing height or less and suffers a fracture to one of their long bones specifically, or the pelvis or to the spine, those are red flag warnings that there are more to come. The single biggest predictor of a future fracture is a current fracture. And unfortunately, spinal compression fractures are the single most common fracture associated with osteoporosis, but statistically almost half of them are clinically silent. So even people who have those predictive fractures are oftentimes unaware that their risk for more is actually present.
So all the more reason, once you hit some of these magical age numbers and points in your life, to start being proactive about scans and bone density examinations and that sort of thing, right?
Yeah, very much so.
Okay, we'll bring it full circle, because I understand that not everybody watching now was watching 13 minutes ago when we launched the stream. Amy asks the question that we sort of started with, but it's probably worth rehashing because, again, people are in and out all the time. Explain one more time the difference between osteoporosis and osteoarthritis, because I do think that's important for people to know.
Yeah, osteoarthritis is where the cartilage between the bones at the joints becomes thin and subsequently lends itself to bone-on-bone kind of irritation that subsequently leads to pain. Osteoporosis is where the bone becomes weak and brittle and patients suffer fractures with little to no trauma, such as a fall from standing height. Frequently patients perceive that, oh, I fell really hard and that's why my bone broke.
Sure.
The bones frequently should hold up to those types of falls and forces, but that's the warning sign that there may be something bigger.
I have 6 kids in the house from ages 14 down to 3. There's a lot of falls, and unless they're falling from something up there, there's a good chance that they're going to be just fine. So yes, to your point, again, just to emphasize, if you're falling just from standing height, and that is enough to do some kind of physical damage to the bone structure of your body, big red flag, it sounds like. Any other lifestyle changes? We've talked diet, we've talked exercise. I always think about what people sitting here with you would ask if they could. What else can we do right now today to try to prevent this from occurring for us down the road?
Yeah, like with most health issues, good healthy eating is important, making sure you're getting in those vital nutrients, the calcium-rich foods. Vitamin D is a frequent deficient supplement or nutrient that patients would benefit from supplementing. But smoking is one of the worst things you can do for your bones and for the musculoskeletal system. So smoking cessation, alcohol use in moderation, more than 3 drinks a day is considered excessive and may have a negative effect on bone health.
I was going to ask you about that because I heard you mention smoking, but alcohol too.
Yeah, frequently the 3 drinks a day on a regular basis is the magic number that's thought about as having a negative effect. You know, obviously there are conditions that people need to be on steroids to live and be functional, but steroids rob the bone of vital strength, and so it's important that if you are on steroids for a long period of time that you're also taking something to protect your bones. Those are basic lifestyle things you can consider.
Gotcha. Big shout out to Rondell, who says this is great information. Thank you for watching, Rondell. We appreciate it. And Nancy Chambers, no relation, I swear, says, how can I get involved in this program because I have osteoporosis? We haven't even talked about a specific program, but that's an excellent question. If there's someone watching right now who's even suspicious that maybe this is an issue for them or could be soon, what are the best first steps? What should they do?
Yeah, you could reach out to us at the Bone Health Clinic at DePaul Hospital at the Orthopedic Center. 314-291-7900 is the number to make an appointment with me. I would be happy to evaluate you, determine are you at risk, and then discuss the options that are available that may be able to help you and prevent fractures in the future.
We'll close with this. Amy Kerber says, whoever said the older we get is our golden years was lying. LOL. Okay, Amy, I get the point. That's where, you know, this is just a part of the privilege of living a good, long life is making sure you're taking care of yourself and keeping up with these things. Matt, thank you for being here.
Thank you.
We appreciate your time very much. Matt Bruns, ladies and gentlemen, thank you so much for your time. For more information, and again, for that phone number that Matt mentioned too, in case you missed that, I'm going to give you a website that'll have all of this information on it and more. And it's up on your screen right now. It's ssmhealth.com/orthopedics. You might not have the legal pad right next to the chair, so let me say it one more time, ssmhealth.com/orthopedics. That's a good starting point. I'm Matt Chambers. Thanks for joining us this afternoon. This has been FYI for your information.